Haotian? How do you pronounce your first name?
Haotian Bai. Yeah,
Haotian Bai. Haotian Bai. Let's see.
Yes.
Well, hello, everyone. Dr. Rob Kiltz from CMI Fertility. Haotian Bai from Patriot Conceptions. And we're here on a collaborative live to share stories about fertility using gestational carrier surrogates, donor eggs, and whatever fertility questions you have, we're here to share, listen and learn together. But I want to know a little bit more about Patriot Conceptions. CMI Fertility, we're one of the leading IVF centers in America. We're one of the most affordable centers in America. And but we also integrate Eastern and Western medicine, nutrition, positivity, faith, and many other things to this journey. And I'm really so grateful to have Haotian Bai here today and tell us a little bit about his company and how they're helping build families around the globe. Welcome and thank you for being here.
Thank you, Dr. Kiltz. Haotian Bai here, and thanks for the opportunity. I'm really glad to be here. So we are Patriot Conception. We are a surrogacy and egg donation service located right outside of Irvine, California. And what we do is we help um, all all populations, either your individual, single parent by choice, LGBTQ, or military families, or international guests. We help build families through surrogacy and egg donation. And as a fellow carnival, and also someone with a surrogate connection, I feel I'm being long term admired for your show. But thanks for having me here.
Well, it's really a pleasure. And, there's so many things we have in common because I was just out in Irvine looking at a place in the Irvine, Santa Ana, to put a CMI fertility center because we're already seeing clients from California coming out to Colorado or New York. And we have so many people that are in need of a surrogate. And finding a surrogate is not that easy. And finding donor eggs is not that easy. And we're always looking for ways to recruit young, healthy women to donate their eggs or to donate their uterus to be used to carry a baby and help build a family. And when it's not working naturally, many people seek IVF. And if it's not working with standard IVF and placing embryos into the woman's uterus, sometimes a woman will take their own egg, partner sperm, embryo, and look to a gestational carrier. And sometimes we don't know why it's failing, but in many times it's either they're missing a uterus, or they have a highly damaged uterus of fibroids or adhesions, or I've had many women with a uterine ablation where the uterus has basically been melted shut essentially, and repairing it is not very helpful, unfortunately. And we're always, we often people will bring their own a friend or family member to be a surrogate or donate eggs. But we at CMI Fertility look towards the companies like Patriot Conceptions to help find surrogates and also egg donors. And young, healthy women is really what we're looking for. Is there the right woman that can carry a baby or donate eggs? And there's a huge spectrum in all of that. There's not one perfect candidate. And a lot of it is individual based on what the intended parent wants in this. Maybe you could tell us a little bit about how you search for a surrogate and or an egg donor, Haotian, and explain more about your company.
Absolutely, a little bit of motivation why we started this business. The reason why it's called a Patriot Conceptions. First of all, I'm an Army veteran. I was on active duty. There was a short period of time I got stationed at Fort Drum, where everybody got to come through upstate New York, airport, and the reason why is actually, a long story short. I had a very close friend who's also a service member, active duty service member. He's a perfect example of someone who struggled. Him and his wife had a long fertility journey, or trying to conceive, TTC warriors, whatever you name it. But they had a long battle. But because the resolve have another whole forum about veteran benefits, how they advocate for the policy change. They went the traditional route that they tried to conceive naturally. They tried multiple cycles of IUI, then IVF. None of those worked, and the what struck me very hard was that back then it's very hard for someone who experienced that kind of struggle to openly talk about their experience and their pain, their struggle. So it's not until later when the tragic happened. What really happened was he had two, he had a twins, newborn twins, but passed away shortly after, 2 weeks afterwards. Then we traced back what happened. He was so devastated. He experienced his stages of pain and suffering, and then he started to open up to us, what really happened. So transferred untested embryo. Dr. Kiltz here can tell you all about it, what how that would endanger the pregnancy or the newborn's health. And he didn't realize all these options. There's third-party options. Maybe when the egg's not good or sperms are neither part or both, either or neither part is good. There's also third party option or uterus. So this motivated me to investigate what are the other options for him or for the other members who struggle from infertility, or someone who's in need of third-party options. Another reason why we named the company this way is because when our first batch of surrogate candidates are actually military spouses. And a lot of reason, because Dr. Kill, you just asked me who would make the best candidates, surrogate candidates. Military spouses, they live in a very stable environment. A lot of them actually live on post. They're guarded by, military security forces, or, in the Army, you call it military police. And you have a patrols, it's safer than usual. They are financially, they're very stable. Obviously, service member on a very steady paycheck. It might not be the highest paid job, but it's very steady. So from socioeconomic and and usually they don't work a lot of also another factor is that military spouses, a lot of them are stay-home mom. They don't have another job that will stress them out, so mentally they feel more relaxed, and they're used they separate from their other half all the time, either due to
Yes.
employment, temporary assignment. So when it comes to separate from your own, your surrogate baby, that makes it a little bit easy for them because they experience that all the time. So that's how we started the business. And of course, when we talk about how to choose a best candidate, there's ASRM guidelines, why they have to check the, all the criteria, infectious disease screening, the BMI, their social welfare, whether they use that, their citizenship status, their criminal background information. There's a whole spectrum of it, but I was talking about very broadly how we started it and what I believe, why this special population represent one of the best candidacy for gestational surrogacy.
And when we're looking for a gestational carrier or a surrogate, and basically another woman carrying a baby, and she's not meant to be the parent, she's going to deliver this child, and typically not with her eggs, and not with her partner's sperm, but the intended parents might be a single woman or single man, maybe a same-sex couple on either side, and it may be obviously a couple, standard couple, as we talk about. But I think that is there a perfect candidate? Someone who's had a child certainly is a better candidate. Healthy pregnancy, a better candidate. And is it better to be under 40? Probably lower risk, probably under 35. But there are women in the 35 to 45 that have had children. I had a mom who carried a child for her daughter. The mom was 65 when she carried and delivered that beautiful child. So I think there's a broader spectrum of it than people understand, and people may bring their own gestational carrier or surrogate to the process, then that's okay. But we're looking for young and healthy, have had children, preferably normal deliveries. There may be some that have had a C-section in there. To me, that's not a reason to eliminate them. But just finding surrogates. How easy is it to find a surrogate for your team?
We run very intensive digital, online and offline campaigns. So the amount of leads we got is tremendous. Like for example, last month we have 20,000 people registered in their interests, and and think of it as like marketing funnel. Eventually, they're gonna fill out their application, to collect their medical record release, HIPAA release form, their background check. So it started to trickle down. Eventually, the one that actually passed the preliminary screening, and they, because once they started to fill out those information, they would know, oh, this might be a disqualifier. So eventually, it is a lot of people have interest. Eventually, the ones who made it, who are less than 1% of the total
Yeah.
applicants. So we did a rough calculation. We had a little over 10,000 in the entire U.S. Based on of course 2021 start data is a little bit behind, but a little over 10,000 surrogacy transfer cycles. So that's they're out there, but it's a very difficult because all the factor you just mentioned, we use that as a screener. A lot of them are gonna fail.
And there's some women that choose to use a surrogate because they don't feel comfortable carrying a child. It's a choice, but many of them do it because of either failed cycles, failed transfers, or they have other anatomic or medical reasons. Some may have severe diseases, or heart disease, or other autoimmune diseases that may preclude them from carrying a baby and being healthy and doing that. So it is such an important thing. And we talked about, around the globe, there are some people and some religious belief systems that may be counter to using surrogacy. They may be counter to IVF and fertility treatments also, but we support the use and need of surrogacy and donor eggs, donor sperm, donor embryos. And family building is a right to all people around the globe. And that's something why I think it's important that everyone's really given the opportunity to utilize this practice of using a surrogate. And tell us any stories that you can tell us, Haotian, about how some of the people came together and what it was like to go through the process and have someone deliver a baby for them and the relationships that may develop during and after.
Yeah, so one of the recent ones we had is actually it was the intended parents. I'm not going to review any names, so it's actually an active service member from Fort Bragg. It was a Black Hawk helicopter, and him and his wife, they struggle from what you just mentioned, failed transfer cycle. Sometimes we had things called unknown fertility issue. Well, eventually, they chose a donor, an egg donor, then they pick a surrogate because the mother's health issue, have a what you had to just mention. She had a problematic uterus, and that doesn't really support a healthy pregnancy. And she chose someone in California, that who lived nearby, and they went through the entire process. And I guess the challenging part of that part of that story is that they, as a service member, they didn't understand when you were on active duty, everything's covered. They didn't understand the difference between the insurance, how complex it can it can get, the different deductible, copay, and network fees, not network fees. So then they started to receive bills, which can be another topic that we talk about, how to reduce the surrogacy costs. And but eventually, they feel what a typical person would worry about. A surrogate will feel difficult separating from the carrier. This actually didn't happen because when the baby's born, because it's easy to say they're not genetically related, there's nothing to worry about, but we still worry. But when they really, the moments, of course, are very precious when they hold the newborn. Everybody's crying, everybody's emotional. They're finally able to realize their parenthood dream, but then the surrogate will look at the babies like this, and they can feel there's really not no genetic connection. There's no resemblance. Um, and yeah, they're very happy. They're actually ready to start their second journey. They're looking for another surrogate.
But there's got to be a very special person that would carry a baby for another couple or individual, because there's a bonding that goes on in carrying a child, I think, and then to give it up. But I know that there are people who donate their embryos, donate their sperm, donate their eggs, and carry a child is just such an amazing thing. And to obviously see the intended parent or parents experience that moment of joy in this.
Absolutely. And what you have just mentioned, how difficult, what the enjoyment is tremendous. Of course, everybody's very happy. Even at the hospital, everybody claps. Like as a fertility doctor, patient always. I think that's in that aspect, we have the same feeling. The best moment is always that picture of a newborn or the smile from a new parent's face. Those are really priceless. But what you have what you have just mentioned, the psychological effect. That's why when we screen surrogate, they do a professional psychological evaluation. To see if this scenario happened, how you would respond to that. Would it be too difficult for you to separate? So that's all part of the evaluation when we screen for someone that wants to carry for someone else.
And you talked about cost, and fertility care is very costly around the globe, and in America especially. And finding donor eggs, donor embryos, and a surrogate. And we work to try to make it as affordable as possible, but you still have to be profitable in order to maintain a business, in order to continue to share the joy of building families. Can you tell us a little bit about the cost of surrogacy? What's it cost overall, and a little bit of a breakdown on how the money is spent?
Absolutely. So surrogacy cost varies in all 48 out of the 50 states. The reason I didn't say 50 out of 50 because there's legality issue. There are 3 states that will cause a lot of trouble. Either will be a situation like in Michigan that explicitly prohibit commercial surrogacy, or some state like Nebraska that would just it's very challenging to get a parental judgment. So, and the last one will be Louisiana. Out of this, so when we talk about getting a surrogate, your options are 47 out of the 50 states, and so the cost, a big chunk of it goes to the basic compensation for surrogate. For their pain and suffering. That varies too from from a low cost region. We would consider like Midwest or the South to the coastal, more costly. It varies. I would say anywhere between 35, and right now 35 is because of the demand. I wouldn't even think of it as a minimum. I would say anywhere between 40, all the way to we seen 6 digits, but I would say usual cases it would go all the way, somewhere around $70,000. That goes to their base compensation, and another big part of it is their benefit package. Their monthly miscellaneous allowance to reimburse for their gas mileage, the prenatal vitamin, and their lost wages. Where if they have a full-time job, and you need to compensate for their missed work hours, and another big part of it would be the medical cost. Fortunately, a lot of the insurance policy will cover the prenatal care for surrogates. But there are cases where, especially in the United States, we know there's an open enrollment period where you can get affordable policies. But there are states very stringent on getting people enrolled in those affordable policies. So varies across the states, and a good example would be in New York. In New York, pregnancy will consider as a qualifying event as opposed to California. Uh, they make it very stringent. It has to be a new family member. Unless you have a newborn, you cannot get one of those affordable insurance, or you change of a job, move, etc. Qualifying events. So that can varies too. But from we seen from 15,000 that would be at the lower end all the way to then there's really the upside is really hard to estimate because think about the with the medical there's never anything, nothing is guaranteed, anything could happen. But if there's specialty insurance, usually a wrapper for Lloyd's of London, they have different names, but they are very costly. It can cost up to 30,000 or more just to cover just their maternity care. Then you have to purchase a different plan for the newborn, especially when they were born prematurely. That can also increase the cost factor.
So essentially, there's the compensation to the surrogate, and that's direct monetary compensation, as you said, as low as 30 to 40,000, but really probably in the 60 to 80,000 is probably more like it. It can run higher depending. Then there's the agency fees, the legal fees,
yes,
insurance for what could go wrong and things like that. Lost wages would be a secondary compensation above and beyond the direct compensation, would you say?
Yes, lost. Those secondary things are lost wages, travel costs, and the bed rest. If they got a note from their doctors, they need to take some bed rest. That's in addition to lost wages. They couldn't find then housekeeping. So a lot, because that's a common practice to offer housekeeping after 22 weeks of gestation.
And there's let's say like we hit a few questions here because it's really great that people come and join us. Alexander Kenny just said hello. Tony Mickelson, a little hello, and we're grateful to that. And we got a few questions. Let me scroll down. Vilma, let's see if I can get that. Vilma says hi. Let's see. Post about surrogacy, and again, we posted it all around the globe. We want to support surrogacy, and I think again, it's back to the right of every woman. Cindy, interested in donor eggs herself because I'm way past the age of having good quality eggs. Is there a way to freeze donor eggs, donor sperm, and which is a frozen embryo? And so essentially, you could freeze the sperm and freeze the eggs, and the younger you are, freeze your own eggs. That's one of those things that's best. And you may be interested in gathering some donor eggs and donor sperm and freeze them separately. But in general, we're going to freeze. We're gonna make the embryos and freeze the embryos and save those for later use. But yeah, that's quite common. And I would say that's probably the most common thing we're doing is we're creating embryos and freezing them. Then we're doing the surrogacy gestational carrier embryo transfer, which works the best. And would you say the majority of the cases you see your clients going through are frozen embryos? Quite commonly, they're PGTA tested for euploid embryos. In some cases, people may be looking for gender, and that's growing probably more and more, that people are looking on the surrogacy side to transfer the PGTA normal embryos. Would you say that's correct?
Yeah.
And so that's growing. Let's see, Tori Mickelson made a promise after we get our take-home baby, we're coming back to donate cycles of my eggs. And we, again, people donating afterwards, that's such an important thing. We appreciate that for everyone, for sure. Commitments and we're just so grateful to all of our patients for all they support for us for sure. Let's see, Kelly, we have 11 frozen embryos transferred to this past Saturday. If we can get one baby, we plan on donating the rest of our embryos for families. And that's another one, Haotian, are you seeing a lot of people that are finding donor embryos and using for a surrogate?
Oh, we had one, especially I think it's more popular amongst single parent, when they would, because donated sperm and eggs, when you have to, do the embryo, it's more costly and it's more decision to make. Sometimes they just like to keep it simple. One of the donated embryos.
And
Absolutely.
there are thousands, if not millions, of embryos on ice that may never be used, and hoping that we can invite more people to help build families for others, because that's what they're really built for. How many times can you feasibly be a surrogate before the process impacts your body? Well, I guess it just depends on how many times you can carry a baby, and and I saw there's another question about C-sections. We'll talk about that, but I've seen some people doing 4 surrogates. What do you guys have a number? You say, okay, we'll use you. That's enough.
Well, ASRM has a guideline for 5 vaginal or 3 for C-section, but that is a guideline. So
that's right. There are guidelines, and there are some people that just do such a great job. And
yes.
I talked to an online a client the other day who's had she's on her 19th pregnancy and all vaginal healthy deliveries, and she's a carnivore. Yeah, that's it. That's great, right? After many failed transfers, we're looking into surrogacy, active military here. And so the military, is it covered for all active military to use surrogacy, donor eggs, and those sort of things?
Unfortunately, no. The military don't have surrogacy benefits. But what we will see, because we just saw the news. Across all 5 branches of service. Now we have Space Force now, except for Space Force and Air Force. I'm sorry, Space Force and the Marine Corps. Everybody else falls short for their recruitment target. But we've seen all the big companies started to offer reimbursement for adoption and surrogacy, like Google, all the big tech, especially big tech companies. So I would see DoD would it might take longer because it's the federal government, everything that got to go through the legislative process, but we can see that started to happen. But TRICARE and the veteran benefits covers. As long as it's service connected, it will cover your IVF.
Right, and I guess the question is that service connected problem is small percentage of those people that are suffering from infertility, because what we see is that it's an unknown cause for most of it. I mean, I think it's inflammation due to our lifestyles and our diets, but for so many people, everything looks normal. And I've seen people with repetitive failed implantation or miscarriages. That's where it's time to look towards a surrogate. And I've had times where we transferred into the surrogate and into the intended parents, and we got multiple babies out of that. And so that we've seen those beautiful, and they're beautiful stories. People are excited about however they're happening. So let's see. We got it. This is a long way. In my opinion, Suchera, I've been a surrogate twice, and yes, there is a connection, but as Bai was saying, it's not the DNA of the surrogate, but when you see a baby in the arms of the intended parents with the tears of joy, is worth everything. You will see the look of the first love when they see the baby, makes everything worth it. I do believe closure is needed for the surrogate to say bye and have time for closure. That's an important thing. Needed for the surrogate to say bye and have time for closure. But from my end, I have never connected like that with the baby, if anything. So again, I appreciate everyone's comments. These are appreciated because this is meant to be a forum of everyone bringing their questions, but also their experience. That's a good one. Let's see, Mawash, Fatima Khan. What are What are thoughts regarding PGTA testing? Should one go for it or not? I'm not a big personal fan of the genetic testing. I don't think it's accurate enough personally, because I've seen plenty of abnormal babies become normal, abnormal embryos become normal babies, and normal embryos not implant or miscarry. But I know the trend is more and more people are asking for it and looking for it. Any other comments? What you got?
With the story that I mentioned, well, it wasn't because of the tested embryo, but it's because 3-day versus 5-day. I don't know if what's your opinion on transferring those 3 days that may not reach a blastocyst stage. Yeah,
I love day 3 embryos. I think they're great. They make a lot of babies. Some embryos will not make it to the blast stage for reasons we don't understand. And I've seen people who wouldn't blast, or their blast wouldn't implant, but we then switched to day 3 and then it worked. So I just say we always have to be a little flexible in this process. When it's not working one way, be willing to change it to another way. Quite often we don't find the why, but we just work on a new way. That's the part that I think is the most. Why? I don't know. The way, we will make it happen. That's the part that I think is the very best, and things that we can do to improve things. So, no more than 2 to 3 C-sections prior. Yeah, natural, it doesn't matter. But again, there's going to be some individuality in why we pick those particular reasons. Can someone who has a tubal ligation be a good candidate for gestational carrier? Absolutely, because a tubal ligation doesn't. It's just cutting the tubes. We're putting the embryos in the uterus. It's the uterine environment, and tubal ligation is certainly not a reason not to be part of that. And again, there are many women out there who've had a tube or even their tubes removed, and they certainly would qualify for that. All right, Kelly, for lost wages, the surrogate has a partner, and the partner has to take care of the surrogate during pregnancy. Would intended parents need to pay for surrogate's partner's lost wages? Is that could be part of the contract, I imagine, because a lot of these contracts are individually defined.
I wouldn't say. I say most of the cases you wouldn't even expect this, because when we talk about the very small percentage of women who would even make the screening process, so they're very healthy. They have absolutely no have a very little complication that have a little impact to their pregnancy, and they had at least one healthy pregnancy in the past. So the chances are that they need to be attended intensively are very slim. And also how the surrogate contract set up is to help you prevent this type of unpredictable situation. So what it would usually do, even for bed rest, let's say if she does suffer from some symptom because of the surrogacy pregnancy, they usually have a cap on how much you would get from the bed rest. So from that said, so our job, or and anybody who help you along the journey, would their primary job to find somebody who's really healthy, that you don't have to experience any of those. And second, if something like that happened, the contract would have a cap in regards to how much lost wages and how much lost wages they entitled to, and how much lost wages their partner entitled to. There's a cap, yeah.
And I imagine there's disability policies, potentially life insurance policies, and so there may be some individual cases in all this, but in general, selecting young and healthy women that the direction is a healthy pregnancy, and there should be some insurance policies to cover some of these things if they were to occur. And I think that's really important.
Yes.
Yeah. Thanks, Kelly, for that. Jennifer, we're all well, super happy. 27 frozen embryos, pretty amazing. Nice.
Wow.
Nice. Yeah, and again, there's so many embryos sitting on ice that people may never use. Hopefully, we can encourage people to share them and pass them around, build families, right? Vilma, I was doing a bit of research, and even if you get someone to see it, no charge, it will still cost 40 to 60 attorneys, screening, medical expenses, delivery, baby adoption. In the end, is that an accurate amount?
I would say if I could do a quick breakdown, attorneys are usually close to 10,000 for your initial contract, parentage, and then your escrow management. Because especially when you don't go through an agency, you need a third party trust account or escrow account to distribute your funds. Screening, that's somewhere between 3 to 4 grand. Medical expenses that varies, but like I say, from 15,000 all the way to 30,000, that could be it, including delivery. And adoption, I wouldn't use the word adoption. There are some states that will grant you parentage post birth, so it's very similar to that process, but that's included in the attorney's fee. So I would say that's a somewhat accurate 40,000 to 60,000, even if the surrogate doesn't charge you anything.
In general, the reason for all of these legal and the right states is so that when that child is born, the intended parents are already identified in the birth certificate. Is that correct?
Yeah, some state does pre-birth. Yeah, they would,
Yeah.
before the baby's born, you already have that parentage established. Yes.
Yeah. Let's see. Success rate of PGT embryo in a surrogate. It's going to be the same as you would use in most women. But that's a good point, because otherwise, women with infertility, may have some other reasons to reject an embryo, even if it's normal. But I'd say it's in the 60 to 70% range on average if you look at those. So, Jennifer, we appreciate you. Also, Courtney, a way to unblock your tubes. We can unblock tubes depending if they're proximally or distally blocked or it's a tubal ligation. But there are some ways to do that. Look at our family building guide or the CMI Fertility website. You get a lot of stuff. And I always say go carnivore. It reduces inflammation. And inflammation is the cause of all disease and all failures, right? Okay, Litsa Mavrothalassitis. Is there a risk once you go the surrogate route, if that doesn't work for whatever reason, and you go back to doing it yourself, that now your insurance will deny coverage for you to do your own IVF procedure because now insurance is taking the position that you're unable to have your own? No, I think if you're doing IVF and you're using your body to do a transfer, and you're also considering a surrogate, you've used them, it's failed. In general, I haven't seen them deny coverage for your own transfer again. But that's a good question. Let's see, 19 pregnancies, awesome. All right, let's see. Hello, let's see, Katie. Do you have a list of OBGYNs that CNO works with in the Pittsburgh area to get the needed tests done to be approved as a carrier? We work with in Pittsburgh. I don't know that off the top of my head, but I know our team has someone, and I don't know if Haotian, you have anyone there, but we certainly at CNO Fertility will help with that. We have lots of OB/GYN doctors in the Pittsburgh area that we'd love to work with you. Haotian, do you have any other comments or things that we haven't touched on here yet that would be important for anyone listening?
Well, a lot of I guess it was for two different type of audiences, but about the same subject. The emerging technology like GLP-1 receptor agonists with a common brand names like Ozempic or Mounjaro. We've seen how promising it is, but from a patient perspective and from a surrogate who wants to lower their weight to qualify to become a surrogate. So for this two different type of audiences, what's your suggestion? First of all, I guess, what's your opinion, if you can explain to the audiences how the GLP-1 agonists work? And second, is it for everybody, and specifically for the two, populations that I mentioned?
Well, if you're looking to be a surrogate and/or you're looking just to carry a baby on your own and you're suffering from infertility, I believe that obesity is not the cause of any of these diseases, but it has added risks because of the damage that goes along with it, secondary to the diet that got you obese. And so I always say go carnivore in 2 to 4 weeks. You'll feel the very best. And I think the risks will drop significantly. Now, if you're morbidly obese, there are a lot of other extra risks that go along if you have to have a surgical delivery, and even a vaginal delivery can be harder. I always say go carnivore or ketovore. That's the first thing you should do. People do a lot of gastric bypass, but I think these medications are very interesting. We haven't seen long-term effects of them yet. Exactly how they work, mostly it's through appetite suppression, and I don't know the wherewithals exactly where the molecular work happens. There's a lot of theories on this, but I think for those people that are really working to get there, a combination of using these medications may be helpful for them, because losing weight is a hard thing to do. And we see the world that's gaining. So let's just say it's nearly impossible, but not impossible. And so I would say that anything you could do to lower your BMI if it's excessive, along with changing your diet, will reduce inflammation, which again, increase your odds of being healthier, carrying your own child, or whether you're going to carry a child for someone else. And then you need to be off the medications to Mounjaro and Ozempic and Wegovy for at least 30 days, and it may be 3 months. We just don't know the effects of these things on a child, a fetus yet. But I would say go carnivore. Look at drkiltz.com. We talk tremendously about nutrition. We're all eating the wrong food, but it's inflammation is the thing more than anything that's probably the factor that I think people can work with. But it's getting healthy starts with a healthy mind. What you put in the mind and the mouth, and you got to get moving. Walking is really great. You don't have to do anything excessive, and lifting weights and doing some resistance work, I think is really important in all of this.
Perfect.
To bring service connected even for the spouse is tremendous. It is important for sure. And would you say that high BMI is probably one of the greatest reasons why people are being rejected as a surrogate? Obesity.
Yeah. Yes, because we see most of the clinics follow ASRM guidelines, so they put 35 as the maximum they would accept. Some even lower to 40.
Which I think those are too. I think they're restrictive. Unfortunately, I don't think a 40 BMI. Again, the weight isn't the cause. The diet is, and we don't have enough data because we're so restrictive, allowing women who are obese to even do fertility treatment. That's one of the unfortunate things I think we've got to change in this world for sure. Amanda Hopewell, if we come to CNY with our own surrogate family member, is there a BMI threshold or is it on a case-by-case basis? It's all about your health and wellness. I don't personally have a cutoff, but many people do, because I've seen there are plenty of obese women that have babies, get pregnant naturally, and have babies naturally without problems. But definitely, it's kind of like if you have hypertension, it's a sign of inflammation. The hypertension is not the cause of disease, and obesity is a sign of inflammation, for sure. Let's see, I have 2 living children, but have had 2 stillbirths with no answers. Also considering IVF, would you recommend a surrogate? I think a surrogate might be a good reason if you have a history of losses and stillbirths. For sure, that's a good reason. My bet is it's all related to inflammation from the diet and our lifestyle we're all living. Any comments? What you got?
But yeah, and from a surrogate screening perspective, if you had 2 stillborn, that would most of the doctor will even disqualify you from becoming a surrogate.
Right. So being a surrogate, yes, that would disqualify. If you have a significant history of infertility or miscarriages or any like a stillbirth, then that would be the reason not to be. But using a surrogate, you're the perfect candidate in that particular case, right? Let's see, Alexander, thank you so much for your words. Let's see here. Crystal Whalen, I'm in Canada. What's your opinion on independent surrogacy and working with the agency? I worked with both as a surrogate.
My opinion, if she's interested in become a surrogate, I mean, just from your perspective, you make the same compensation because not as the intended parents, and with agency, since they're more experienced, you would have a relatively more of a smooth journey. But
And,
that's
and we recommend at least a surrogacy attorney to get the package filled and do all these things. But you need someone to smooth it out, and the agency has a lot of experience in helping make that work. But an independent around the country, you're going to need a legal document that has to be drawn up that I think is very important to do, and you're going to get a little more benefit by using an agency like Patriot Conceptions. Would you agree, Haotian?
Yeah, and most importantly, like if independent surrogacy was something you choose to do, legal documents that's very important, like Dr. Kiltz said. Also, the escrow, make sure you have a neutral client attorney trust account that will make sure you get paid through
Yeah,
those.
yeah, yeah. I think that's very important to do that, and that's why these surrogacy laws have been created. And some states just say compensated surrogacy is not allowed because there's a lot of bumps in the road. But I think we know that 47 states have those laws today that make surrogacy a much more smooth process. It's not, creating a family, building a family, and having children is not inexpensive. But I always say, imagine wherever you're at, you already have that child. Start putting in that baby bank the money that's going to grow, and so you're going to be able to have more access and affordability to all of that. Do we need an attorney no matter what? We plan to use a close family member. The answer is you don't need one, but ultimately, all the clinics and with CMI Fertility, we require an attorney's evaluation and documentation in order to make this work smoothly. Because when it doesn't, that's where we don't want to go in this world. Agree?
Yeah,
Any other comments?
I would say you definitely will need an attorney, especially for the parentage. How are you going to handle the court filing? How are you going to get your name on the birth certificate? If unless you have a legal background, that's really difficult to do. Yeah.
You need it either before, during, or after. Why not get it ahead of time? Put all the ducks in a row, the babies in a row, the baby ducks in a row, so it'll help make it happen and all that. I agree with you. Thanks. It's part of there's so much free information out there, and our forums are all free. Our many of our at CMI Fertility publications are free through our website, a family building guide, and there's so much content out there and so many people that have experienced this that would be willing to help. Haotian, do you have a fee for people that just want to get information about your center and whether or not that using a surrogate and what the costs would be right for them?
No, not at all. We don't. Nothing at all. We actually don't ask for any money until they're happily matched with the candidates. So I guess we're one of the few one that will do it. So we'll have you do the Zoom meeting with the candidate that you pick until. So yes, absolutely, absolutely free. Yeah.
And Crystal Whalen, do you have a financial plan? So at CMI Fertility, we have lots of payment plans, but when it comes to any outside financing, that's something you'll have to work with. There are some companies that finance, and I know through our CMI Fertility website, you probably find some of those. Do you have anyone that you work with, particularly through your group?
Oh, for me, usually they are through Prosper Health Landing. Those they're packaged personal loan, but they just have a different name for fertility.
Yeah, there are lots of healthcare loans out there.
Yeah. There are lots of it, but I say there are also grant opportunities where they're basically free money. If you look through Fertility IQ, there for military member there's a Bob Ujwov. Like even if you're symptoms is not service connected. Bob Boudreaux, he was an ABC news anchor, but he get blown up in Iraq, so he has a foundation to help the veteran cause. But then he has a program designated to help you cover IVF. That's definitely something you look into. Free money. So.
And we see a lot of Bob Woodruff grants coming through CMI Fertility, and a lot of it is because we have a lower cost, and you get more bang for the buck.
Mm-hmm. Yeah.
Michelle, best advice to improve egg quality for a 40-year young and unexplained keto carnivore, faith and fasting. Keto carnivore, faith and fasting. Those are my number ones. And look at CMI Fertility Family Building Guide and Kiltz's Keto Carnivore Guide. And that's really the things that and visualize the baby in your arms as if it already is. And then let God handle the rest. That's one of the things I think is so important. Close location to Nova Scotia, Canada. Let's see, CMI Fertility is in upstate New York, and and Patriot Conceptions, like all of us, we're all online. You can get to us from wherever, but let's see, Nova Scotia is going to be closest to Albany, East Coast, if I remember right. Rachel, Diana, Hudson, why is there a limit for number of births for surrogates? Well, the complication rates for pregnancies go up after 4 to 4, but again, it's going to be individually based. And you guys don't have an absolute number?
We follow ASRM just so we know most clinic would accept them.
Yeah.
I think I have a follow-up question if it's okay with you. What's your C-section? Why would they have a lower? Your opinion as fertility doctor. What are the increased risks for C-section?
Well, the more C-sections, then you have a risk of uterine rupture and complications, accreta and other placental complications and bleeding. So, most people recommend no more than 3 C-sections, but maybe it's going to be boosted to 4. But if it's a surrogate and you're carrying a baby for someone else, that might be another reason that people would say no to it. But it might be a close family member, a sister, someone like that, where, it's sort of like you might look at those reasons. I think it's less the fertility center. It's going to be more the OB doctor to get their clearance. And then we ask the OB doctor to make sure that they say, yeah, we'll be glad to take care of them, and we feel comfortable with that surrogate with their history. Let's see, Vilma, no matter what you need an attorney, no issues at a hospital on birth certificate making you as parents, even if it's your mom, it's 8,000 to 10,000 plus medical screening, 1,000 plus transfer 2 to 3. That's like the minimum on top of this medical care delivery. If SM has insurance, need to check if her insurance will cover if she carries not her own baby. That's another big one. That's very true. Again, some insurance carriers, it's okay, and because you're pregnant, they don't care where it came from. And others, you need to make sure of that. And those are all things that are done ahead of time.
Absolutely. And what I want to add to that is that it might seem to be the same policy. Let's say you have United Healthcare or like Blue Shield California, Gold Plan, PPO, 90-10, or it's really good ones. But then if it's employer sponsored, they might have a small provision that exclude certain things like surrogacy. So those are hard to figure out. Is when surrogate have their own, most likely when they have their own policies through an employer, and you have to look up those provision that allow the policy to cover for her surrogacy pregnancy.
So if you have your own, do it. So we have our own egg donors, and we have embryos that are often donated, but we will work with Patriot Conceptions to help find both of these for anyone. And you also help find fresh donor eggs. You're not collecting eggs and freezing them and having them in a bag. Do you have them in a bag?
Fresh cycles for our donors, yes.
What's that?
It's all fresh cycle that usually agency only do for fresh cycles.
Right. Which I think is really good for a lot of people that just failed from frozens and looking at fresh, and you want to get all of them for sure. Jenny Robertson, thank you so much for that question, by the way. Crystal Whalen, I agree, definitely legal needs to be involved. Absolutely. Again, your comments are really appreciated. At Patriot Conceptions, the way to go. Let's see, and thank you, Wilma. Wilma, appreciate you. Miriam, let's see, get that. Miriam, my lawyer is only 2,000 plus 15 for afterbirth to be filed. And I think you're going to search around and you're going to try to find and save some money here and there, and that may be the way to go. But certainly, I think that having someone that's done this a lot is really good. The veteran Patriot Conceptions, is that the question?
He was asking for the brand, Bob Woodruff, I think. Yeah.
Oh, Bob Woodruff, yes, Bob Woodruff, and we work with them quite a bit, as I said, and we're doing a grant for IVF, and maybe we'll work on a surrogacy grant and work on all of those things and work with Patriot Conceptions to help them more accessible and affordable for everyone. All right. Let's see. Bob Woodruff, yes. Do you need a lawyer using donor eggs for IVF? That's another interesting one. In some way, legal advice is always a good thing before you do any of this care. And especially, again, it's with there's a lot of things. How are you going to handle it if there's separation, divorce, or loss of a life? In all these things. These are things that we don't expect to happen, but who takes control of all these things and what happens to them if there's a dispute, right on? Yeah, New York, upstate, let's see, Alexandra, let's see. My aunt is 59 and wants to have a baby. She doesn't want to come to see my fertility to ask her a question. Any suggestions? Alexandra, we're here to help. We have had people at 59 deliver babies, quite healthy, by the way. And we like to make sure that they're healthy. They've got a good doc, primary, and also a good OB that will take care of them. But just send her Kiltz's information. Be glad to talk to her. Let's see. Is it normal to bleed after HST procedure? It can happen for sure. And there's some testing that's recommended, but you want to make sure the uterus is normal. Hysterosalpingogram, saline sonogram, pelvic ultrasound, those are all important. And then looking at metabolic, liver, cardiovascular status, those are all very important. And then mindset, and we talk about the emotional, and all these things are very important. And I guess you also probably get a chance not only to talk to the intended surrogate, but also other people living in the household, and partners. Haotian, is that true that you also would not only screen the intended surrogate or interested surrogate, but also other family members?
Absolutely, their support systems are sometimes more important than some other factors. If they have a long-term partner, they're going to participate in the psychological evaluation too, or any close family members. But usually, just the partner, their significant others. Hello, I think I missed it. It's frozen. Wait, is it me?
I have no power in my neighborhood because of the storms, and so I'm on generator power, and it just had a glitch of the power, and my other source went dead. So I'm back. Where were we?
Oh, we were asking about how if we screen the support system, like their significant others, and the answer is absolutely yes, and they will participate if they have a boyfriend, husband, or any life partner, they will participate in the mental health evaluation along with the carrier.
Very, very, very important for sure. Let's see. And again, Rachel, it's our pleasure. It is very valuable information. Let's see. In the middle of my journey now, I've had multiple miscarriages. So now I'm doing surrogacy. That again, so many people are looking that route. And I think, again, the more we have people like Patriot Conceptions share their story and tell people about this opportunity. So, hello, Luciana. Let's see. All right. Let's see. Jenry, thank you. Not a candidate for IVF. So many doctors here locally said I should look into donor eggs. We've seen women in their mid 40s who, and even women younger with lower AMHs, do a few things like priming and keto carnivore, and their egg quality, embryo quality, and uterine environment can be improved. By the way, it's our pleasure. Our pleasure. Yes, it froze. We died for a moment, but we're back, and I think it's maybe it was like the time is up. I don't know if it spelled that, but we appreciate everyone today in Haotian Bai and Patriot Conceptions. Any other final closing comments? Do you have any final closing comments?
Oh, no, but thanks so much for the opportunity. I thought you were asking about the audiences, and absolutely, there's tremendous. It's a very helpful, and of course, we've been advising the best practice. What the best practices that you mentioned in the slide, we've been mentioning that to our the intended parents and the surrogates. Information is a cost to a lot of things. So sometimes you got to simplify. Just put the names aside. A lot of attribute to inflammation. Carnivore. Lifting, all that healthy lifestyle. We're big advocate for that, so we can have more healthy women to help change lives. For yes,
absolutely, and healthy women, healthy men, healthy parents, healthy family, and surrogacy and donor eggs are an abundant opportunity that we're going to see growing in the coming years. And how can they find you?
PatriotConceptions.com. We're on LinkedIn. We're on social media. A lot of you joined through the social media here. We had a little collaboration, but it's digital age.
And we want to all join and follow each other. So important. And we're here to tell. And Alexandra, I'd be glad to review it with you. And again, thank you to Crystal and Alexandra and Cindy and everyone else being on here today. Dr. Rob Kiltz and Haotian Bai from Patriot Conceptions. Blessing to everyone. Thank you for stopping in.
Thank you, Dr. Kiltz.